Hello, everyone. On behalf of the Spina Bifida Association staff, welcome to the Spina Bifida Association's webinar, A Tale of Two Wounds. My name is Judy Thibodeau, a member of SBA staff, and I and my colleague Juanita Panliner will be with you for tonight's presentation. This webinar will be presented by Jennifer Wilhelmy. Jenny has worked with adults with childhood onset disabilities for more than 30 years in group home, clinic, and hospital inpatient settings. As an adult nurse practitioner at Gillette Children's Adult Services, she provides physical medicine and rehabilitation services and wound care. Jenny has a Bachelor of Science and Master of Arts in Nursing, is a certified public health nurse, is certified in wound care, and is board certified as an adult nurse practitioner. The health of one's skin is important to all and of particular importance to people with spina bifida. People with spina bifida usually have areas of the body where feeling is absent and skin breakdown may go unnoticed. We are grateful to Jenny for this presentation tonight on a matter of great importance to our community. Before we begin, a few housekeeping notes. If you have a question or comment, please feel free to use the Q&A feature at any time, and we will try to get to as many questions as possible. You will receive the recording of this presentation and an evaluation survey after this session. Please take a minute to complete the evaluation so that we will learn what topics are important to you for sessions like this in the future. Lastly, today's event is being recorded and we will post the video to our website soon. And now on to our program. Jenny?
Thanks for the nice introduction. Just get going here with our slides. I come to you from chilly Minnesota, where it was about 8 degrees when I got up today. So I'd like to kind of start this presentation with some objectives, looking at risk factors, key steps in helping you maintain healthy skin, 3 examples of protective skin strategies, and then reintroducing and learning about the Did You Look campaign. And so as we get started, I welcome you here. I welcome your questions. Doing skincare and wounds is something that came to me with just the type of work that we do. It's not something that I grew up thinking that this was going to be part of my practice. It's just over and over, patients kept coming back to clinic in physical medicine and rehab, complaining of skin breakdown or finding wounds. And so we had to find a way to look at that. So looking at kind of one of my more favorite articles that talks about kind of the national registry data, focusing on why we're doing this presentation, looking at this larger review, that 26% of patients with spina bifida who came and completed their registry data said that they were having trouble with wounds. Our thing is progressing on its own. It's got a little mind of its own, so hopefully I can keep it under control. 19% reported a pressure injury in the past year. So, for me, that would be like 1 in 4 to 5 patients, which tells you that this is a really serious issue that a lot of individuals with spina bifida are dealing with. And so how can we get to the root of prevention so that it doesn't have to interrupt lives? So I want to take you down the path of 2 different patients, looking at their particular situation, their wounds. Full disclosure, this comes from a mix of patients that I've seen, and I went on to some new technology to look at kind of virtual reality and the new like ChatGPT for those of you that are really techie, and a program called Dolly created Joe for me. Joe's experience comes from the experience of many of my patients, but without giving away information that might give the identity of the patients. It was a great way to use virtual reality to create Joe. So Joe's an 18-year-old. He's getting ready to go to college. He's excited about the future. He can't feel the skin below his waist, and that's below his myelomeningocele lesion, but he checks the skin every morning with a mirror. And if you learn nothing today or take nothing home with you today from this visit with me, it's that he is looking at his skin every morning with a mirror, front, back, up and down. And today he notices some redness. And this takes him by surprise because on his daily check yesterday, there was no redness in his buttocks area. So he updates his care partner, which is currently his mom. And together they decide to watch the area for a few days to kind of see what's happening. And when it isn't gone in a few days, they schedule a clinic appointment for further evaluation. It's found that Joe has a stage 2 pressure injury on his right buttocks. Buttocks pressure injuries are really common, especially in individuals with spina bifida. They rank probably in close tie to foot pressure injuries, but I see a lot of buttocks pressure injuries to the point where some days the staff that work with me and some of the patients that have seen me for many years call me the gluteal goddess. Not really something that you want to be known for, but it's because we're looking at so many butts to make sure that the skin is intact, and if it's not intact, to correct and help to heal these wounds that are happening in the buttocks area. So Joe's pressure injury looks like this. And again, this has a little bit of a mind of its own. So hopefully it'll stay put. But you can see where I've circled the wound where Joe has a pressure injury. And some facts about Joe is that he has a Roho cushion, that he sits on this cushion for about 15 hours per day. But about every hour he uses his forearms and his arms to lift up and do a pressure relief off of his Roho seat. But he's noticed that it might be losing some air. And when our seating folks go in, they do in fact find that in that quadrant where the buttocks is, there is a loss of air, which causes him to bottom out on the seat, which is causing this skin breakdown that you're seeing circled on the page. Another thing that's interesting about Joe that I see all too often is that just in case he wears 2 briefs and not just one, so 2 incontinent products, because like I would be, like probably a lot of you are, worried that there would be an accident that would cause him to have wetness or a bowel accident in between trips to the bathroom. And none of us want that. And so when he's wearing 2 briefs, this causes some bunching and increased pressure over both of his buttocks cheeks. And so it's important that we acknowledge this and try to help. What are some ways that we can help this to occur, help to reduce the pressure that might occur in this area. And so my friends in urology will often meet with folks that I'll refer over. They in fact sit right across from me, which is I'm so thankful for, but they'll help to look at what are some areas that we can work on as far as bowel and bladder incontinence that will heal wounds and prevent wounds in the future, and maybe avoid that situation where a double brief is needed. So Joe came in early to clinic. The treatment that we prescribed was, continue those wheelchair push-ups, continue those daily skin checks. We needed to order a new Roho cushion because that one was no longer holding air and it couldn't be repaired. And then to apply a barrier cream. You can choose the brand that you want. I'm not here to promote different brands of barrier cream, but that barrier cream over that entire buttocks area will seal that in. And if there is an episode of incontinence or increased perspiration or wetness in that area, it will protect the skin from absorbing it like a sponge. And when the skin absorbs incontinence like a sponge, it's more likely to fall apart, and it puts it at increased risk for pressure injuries. And so the use of that barrier cream in this situation is a treatment strategy. It's also a prevention strategy for the future. So when this wound was healed 2 weeks later, we encouraged Joe to continue to use the barrier cream even after the wound was healed, because we want to prevent future wounds from occurring. So the total course of healing for this stage 2 pressure injury was 4 weeks. And so we want to keep that in mind, because when you hear Jody's story next, it's going to be a greatly different approach. And so early, Joe watched his skin every day. He saw the redness that was happening. He came into clinic early, and within 2 weeks after coming to clinic, he was healed. He missed a few days of hanging out with friends, but he was able to connect with them virtually. We're in times where virtual connections are almost more common than in-person connections. And so he was able to kind of get this healed, get off to college and on with his life, which is just tremendous. I mean, it's like the best case scenario other than not having a wound. But let's move on and let's look at Jody and what she was up to. So Jody, she's 21. And again, this has a little bit of a mind of its own. She's 21. She works at Target about 20 hours per week. She sits in her wheelchair again about 15 hours per day. And when she's transferring from her bed this morning, she notices some blood on her sheets. This continues to happen every day for the next few weeks. She's not quite sure where it's coming from. She has a good idea. It's not a lot, so she's not too worried, and she's not feeling any pain anywhere. She wants to be super independent, so she doesn't tell her care partner, which is currently her PCA, about the drainage until one day her PCA notices when she's helping her to change the sheets. So she presents to clinic, and this is about 2 to 4 weeks later. She presents to clinic finally, and we start to have a conversation about her wound. And this wound is on the bottom of her foot. She says she recently got this cool pair of new shoes. They're just awesome. They have some glitter to them. They fit her AFOs well. She just loves them. It's just like the best thing ever. But shortly after starting to wear the shoes, she noticed this wound. She has lack of sensation below her waist again, below the myelomeningocele lesion. Her weight has been stable. She's got a power wheelchair with custom seating, and a commercial backrest. And again, she presents with a 4-week history of skin breakdown on that right foot. So we think about first a treatment. We put on our detective hats because we're trying to figure out, is it the new shoes that are causing it? And so we take those out of the loop, and we find that we need topical care, and this takes years to heal. And I want you really to see that kind of red spot, superficial skin breakdown that Joe had, that was weeks. He lost less than a month of time in his normal life. But for Jody, because the wound, again, was so severe when she presented, and I will click back to that photo quick, if it will let me. I'll just stay here. There we go. We'll click back to that photo. If she would have come back when that spot was red, I truly believe that we could have made adjustments that would have been prevention and preventative to when this became a stage 4 pressure injury. And so we want to make sure that, again, if you take back nothing from this, it's that we're looking every day, we're identifying red spots, and if they're not going away, we're getting quick interventions to help with healing. And so she was seen by many skilled professionals, and then the wound did not want to heal. There was surgical debridement, there were IV antibiotics, there were no shoes, there were pressure relieving boots, missed work due to clinic appointments that were weekly, hospital stays for infection, 2 years of missing out on swimming and camp and wearing super cool shoes and hanging out with friends. And it wasn't until a very minor adjustment of her footrest in combination with topical wound care that we finally got complete resolution of this wound. And you can see here that it's healed, and that it's not there, and it has not recurred since that point in time. And so we have 2 stories about 2 wounds that went different paths. a very long path that can be so stressful for the family and the patient, and even for us as healthcare providers, because we really want you to be healed. That is our goal. Our goal is for you to be living life to its fullest potential and not to be seeing us for wound care. What I tell the patients that I see is my happiest days are when I can talk with you in the waiting room and not see you in the wound clinic rooms. Those are the happiest days that I have. So let's talk about it. If 1 in 5 of our patients has skin issues that may be preventable, how do we reduce the odds for them developing skin issues? I mean, 1 in 5, some of the statistics are 1 in 4. So of the people that come in, years ago at Gillette, we did a little mini survey. I still go back to it with my patients time and time again, because what we found was that we asked all the patients when they got into their clinic room, do you have any skin breakdown right now? And 50% of the patients said no, but then when we did the physical exam, they actually had wounds. So wounds they couldn't see, feel, reach. And so that's where that mirror comes into such importance. And so I'm going to be showing you some of those tips as we go through. So 1 in 5 of the patients has skin issues that might be preventable, and prevention starts with a look. And you're going to hear that from me over and over again. So this is the first kind of thing that SBA and working with the CDC several years ago and a big team of health professionals from throughout the United States. I love this one page. I'm going to show you the brochures as well that you'll have access to, but I love this one page because I feel like this could easily be like on your mirror in your bathroom or in a drawer that you opened that has all your supplies, so that you can remember that prevention starts with a look. Conduct a daily skin check, avoid pressure, control moisture, eat right, drink enough fluids, and then act quickly if you see any areas of redness. And it even gives you signs of trouble that you can be watching for. If you're looking at your skin and you see one of these, call your clinic team immediately to help you troubleshoot whether you need to be seen, whether equipment needs to be repaired. And I like the graphic too, because the patients that come to see me are not just the patients that are seated in wheelchair. I often have ambulatory patients with wounds as well. And so it's important that if you have lack of sensation and can't feel an area, that you're looking at it and it's at risk for skin breakdown. So what are some of those risk factors that the community of individuals living with spina bifida has? Poor absent sensation, incontinence or moisture, inactivity or mobility, heat, poor nutrition, hydration, and then just overall physical condition. And we're going to break these down one at a time so that you can see what are some of the risk factors. Where do you maybe fall in, or a family member or a loved one that you're helping to care for, or you're their care partner? Where do they fall into those categories, and how can you be an agent for prevention and an agent for change? So the first one, impaired sensation. This chart might look a little childish. I have presented it in many different arenas. But I think it's important, and you can make this a female, you can make it a male, you can change, you know what I mean? Help to customize it. The internet is amazing, so you can change everything about it. But I think it's important from a young age for you to understand the parts of your body where sensation is good and where sensation is fair and where sensation is just gone. And so often having a chart in the beginning stages when you're younger, and then as you get into your teenage years, to able to document this can help you really target and help train your staff or your care partners that are working with you as to, these are my troubled spots that we really need to pay close attention to. So use a chart or a picture to document these areas. Can you feel things in all these parts of your body? Can you feel a light touch? Can you feel a pinch? Can you feel pressure? What if there's a temperature change? Can you feel it there? What if you have pain? Can you feel it there? And these will help you to highlight those troubled areas. Skin checks every day. I want them to be as routine as brushing your teeth, unless you don't brush your teeth. Then I want them to be even more routine, but brushing your teeth is a good thing too. So I want you to brush your teeth and I want you to check your skin. You can go to the dollar store, which at our locations in Minnesota is now the $1.25 store, because nothing costs $1 anymore. It all costs $1.25. But you can get one of these handheld paddle mirrors that I see, and I've typed in, did you look? And you can use that to look at all different angles of your body. I've also had family members help people to mount mirrors in positions so that when you're in the bathroom, you can see your backside. You can see your front side, you can see your side. So just being creative with where you put mirrors is important, because you still want to be able to protect your privacy, but also to be able to see places that you can't see. And there are places on my body I can't see either. And so I have to use mirrors, you know what I mean? If I feel something or there's pain or there's a reason to look. So making sure that wherever you live is set up so that you can do that, or have a care partner that can help you do a skin check. And this is important too, but checking every day. We're looking for redness, blisters, sores, cracks, peeling, swelling, anything that's not your normal skin. And then using a mirror. And now there's a newer thing. We have not put this into practice yet, but I've had several professionals bring it to our attention, but it's called a habit camera. So this is a camera that's on a telescoping lens that goes to an app on your phone so that you can do your own checks. You can either delete them, you can save them into private folders. They can also be used to communicate changes in your wound to your healthcare team. And so this is another option, I think, that's under $150. And I know everybody doesn't have $150, and I'm not saying everybody run out and get a habit camera, just giving you options. The $1.25 mirror is just fine. It gets to all the places you need to see. And a care partner is even better if you've got that, because they can put hands, eyes, everything on those areas. And then I got a shoe full of rocks here, because I've often had patients come that have had things in their shoes and they put their feet into shoes without feeling if there's anything inside, or kind of shaking them out, especially in the summer months. So making sure there's nothing between your skin, your shoes, and your braces that can cause a wound to occur. We've had nails go through the bottom of shoes, and then people put their foot into the shoe through the nail, and because you don't feel, they don't realize there's a wound until they take the shoe back off later in the day, and there's obviously signs of trauma and bleeding. So checking shoes, braces, etc., for any trouble things that could cause skin breakdown. All right. And then washing and drying. It's super important to wash your skin every day. If you don't have accessible shower, bath, those kind of things, that's okay. You can wash your skin every day with just a sink, a washcloth. One is soapy, one is clean water, and you can scrub everything and then rinse it off. And that's okay. I want you to check the temperature though, because I've treated multiple patients coming in with burns from water that's too hot. So making sure you're checking the temperature before you're getting into a bath or shower, or even in the sink as it's running. Use a mild soap, use a soft towel, and make sure that you're paying a special attention, especially attention to toes and the bottoms of your feet. So getting in between toes, drying in between toes, those are super important and can be trouble spots for folks. Use a barrier cream in the buttocks and peri area and other areas where there may be too much moisture. And it's okay to use a moisturizer if you, especially when you live in Minnesota, we get super dry skin in these winter months, and we can use a moisturizer everywhere on our body except between our toes. When patients use moisturizers between their toes, they tend to be at increased risk for yeast infections and fungal infections because it's just too moist between there. Wearing braces. Wearing braces is essential. It's the way that a lot of our community gets around and has good support. And so watching for feet swelling, leg swelling. If that's occurring on a routine basis, get back in touch with your orthotist or provider so they can make adjustments. Don't just try to squish swollen skin into a brace. Braces break. The straps become loose and torn. Velcro loses its grip. So it's important as those things are starting to kind of break down to make sure that you get in to have them repaired. Having a annual visit, with your physical medicine and rehab doc or your spina bifida clinic can be super helpful in kind of preventatively troubleshooting some of these equipment issues. I've had people come in with duct tape taped around the AFO to keep it in place, and that can be very hard on the skin, or bandanas that are placed so that the AFO, it's still rubbing back and forth because it doesn't have good placement. So making sure that as things wear out, we're getting them replaced. If you're noticing any red or pressure areas that don't go away after you take your brace off at the end of the day, make sure that you are making an appointment to have it adjusted, because over time, foam can break down, plastic can crack and have weak spots. And so it's important that we get those under control. Juanita, you may have to take over. It's now completely taken me out. So sorry for the technical difficulties. It's
Sure, no problem. Hold on just a second.
Jenny, do you see the question?
I do not see the question,
So
but
do
I
you
can go.
recommend using a barrier cream in the peri area at all times for kids with incontinence?
Yes, at all times. I like it to be applied at least twice a day, morning and evening, and then for any episodes, of incontinence in between. Very thin layer. We're not talking about thick, goopy layers. We're talking about just a very thin film that you're creating to protect it. Because again, patients will come to me as adults that say, like, as a kid, I was incontinent and I didn't have these problems. And our skin just over time becomes less and less tolerant of incontinence and pressure. And so it's important that we protect it. And if we start using a barrier cream as a child, I feel like it goes a long way. And you can start as an adult too, but yes.
Sorry for the technical difficulties. We're getting there.
No, we're good. We're answering some questions. I don't recommend preventative dressings. I understand their use. They're very common in inpatient settings. From my personal experience in the state of Minnesota, I don't have any current insurers, private or public, that will pay for a preventative dressing. A Mepilex sacral dressing, I think it's around $10 or $15 per dressing currently through the local suppliers. And I haven't checked the Amazon price, but it's just too expensive for its benefit. Plus, if you combine that with any kind of incontinence, you're almost holding moisture, because the foam dressings are not very accommodating to moisture. So that's my 2 cents. Even in inpatient, I don't use a lot of preventative dressing because I want the nurses to be looking, and the families to be looking for any signs of changes. And I feel like when you cover something up with a dressing, you're giving people permission not to look underneath it. And so that's kind of where I'm at with that.
I'm just going to stop the screen for just a moment until we can see what's happening.
Yeah, that's fine. Sorry about that, everyone. We were going along at a bit of a clip and then I lost all control. Are there any other questions, Judy?
None that I see at this time. This is a good time to ask what's on your mind.
Yeah. Let me pull that one up.
what
Yeah.
question just came in. Would you like me to read it?
Yeah, that'd be awesome.
It says, oops. Oh, it came in through the chat. Sorry, my mistake. Hold on. I am the mother of a 33-year-old with stage 4 buttocks wounds. I advocate on her behalf and have run into multiple wound care specialists who will not see her unless she has an appointment and will assign the next appointment available, sometimes 2 weeks away. What would you suggest if the healthcare professionals delay being seen? Should we go to the hospital?
Yeah, and so this can be a challenge depending on the area that you are living in, and what the resources are. I would say, I hate to like in outside of Gillette, 2 weeks is pretty quick for a lot of the bigger wound care centers. I hate to even say that, but that's that just is what it is. I think that it might be possible to do some things before you're seen by the wound care provider, to be able to take pressure off. You're never going to go wrong by getting somebody out of a seated position with a buttocks wound and allowing healing to occur as you wait for your wound care visit. The only time I really recommend the emergency room is if you're seeing increased redness, necrotic tissue like black, gray, tissue that smells, you're visualizing bone. Those are reasons you would go to the ER, because you're going to wait a long time and you're not going to really get a lot out of the visit. They're not going to give you a good wound care plan usually in the ER. They'll probably put you on some antibiotics you may or may not need. But if you have signs of infection, you definitely want to seek ER treatment first.
Jenny, I know you don't
Yep.
want to suggest a product, but what kind of
Yeah.
barrier cream do you suggest?
Okay, so I don't work for any companies. I have nothing to disclose, but currently my favorite is Critic Aid Clear, because it goes on clear and you can see all the skin and you can keep looking. You can buy it on Amazon. You don't need a gift card or a prescription. It'd be nice if you had a gift card because that would pay for it. But yeah, that's my favorite. And they make an antifungal version as well. So if you have a little flare up of redness that might be associated more with fungal, you can use that intermittently. So those are my two go-tos right now. I try to avoid anything that covers up the skin so that you can't see what's really going on underneath. And some of the barrier creams are very thick, hard to remove. You can't really see what's going on underneath. So that's my favorite right now. Again, I don't work for Coloplast or Amazon or any of those.
May I ask another question?
Sure.
Are you familiar with plastic surgery for pressure sore flap surgery?
I am. In my opinion, and the opinion of the plastic surgeons that I work with currently, plastic surgery really is the last resort treatment in the healing of a pressure injury. And the only way to qualify for that, again, with the group that I'm currently working with, is to make sure that we have taken lifestyle modifications such as pressure offloading, if they're a smoker or vapor, not smoking, sometimes weight loss, sometimes diverting colostomy to remove bowel incontinence. There are a lot of steps, nutrition maximum, before we even get to the point where we would consider a flap repair surgery. And it can be frustrating for families because they feel like it should be an earlier intervention, because in their minds, and this would be in my mind too, if I was not in this role, and it has changed over time because I've been doing it for so long. They feel like surgical closure would be faster. At Gillette, we only do it for patients under 26 because we're more of a pediatric inpatient facility. And those patients usually have a 6-week stay as well. 3 weeks of that is no sitting at all. They're flat in bed, rolling side to side while that flap starts to heal. And then an additional 3 weeks of graduated sitting in increments of 15 minutes till we get to full-time sitting before discharge. So it's a really long process. And the reason for that is that even in the best situations, the literature tells us that the failure rate of flaps to close wounds can be as high as 70%, even under the best circumstances. And so for a hole that is maybe this big, I'm talking, a wound hole that's this big, they have to make a flap that's more like this big. And so if that breaks down, not only do you still have a wound, but you have a wound that's about 4 times the size that it was before. And so it's a big endeavor, but it can be done. It's been done successfully. You just have to be very, very careful planning. And so that's why if we can get more patients in with red spots or superficial breakdown, and more looking, I think trying to avoid the flaps is the way to go.
May I ask again?
Yeah.
Do you have any tips for adults about ways to remember to lift up in your wheelchair seat to relieve pressure?
Yeah, I mean, I'm often working with the patients that I'm with to set different reminders on their different devices. So almost every patient that comes to me, no matter what their socioeconomic status is, where they live, who they live with, they almost always have some type of electronic device that has the capability to set an alarm. And so we'll set reminder alarms throughout the day to do pressure, lift up, to do nap in your lap where you're leaning forward. We'll schedule times where they're actually fully getting out of the chair into side lying. Now, can we all ignore those things when we get home? We can. Probably all of us can think of a time where we ignored an alarm or a recommendation, but it's just trying to set up as much as possible for success. So trying to kind of learn those things. Some people do really well setting that up for TV commercials. If they're really into like TV and stuff, we'll try to kind of do some programming about, every time there's a TV commercial, when you're watching your shows, you're going to lift up. But that can be harder if they're watching longer movies, etc. That's why the timers can be beneficial. So.
Okay, this is about a wound on the bottom of a foot. It's been healing for years. She has a callus that will not go away, and ever so often it gets a blood blister under the skin. She's 17, getting ready for college. She wears AFO and she walks.
Yeah, so the callus is just your body's way of telling you that that area is still under pressure, whether it's from actual walking or from the brace that you might be wearing. So it's probably a good idea to get back with an orthotist if you're working with an orthotist for that brace to look at any further modifications that can be made to the area. The blood blister, again, another way your body is telling you like this area is still under pressure. The more times it's injured, the less strength it has. So some of the studies show that 80%, you get about 80% strength back for each injury. So, that's a reduction of 20% in skin strength. And so it just is an area that's always going to be an issue, but there are many products on the market that can help. And the orthotists are usually really good about knowing what those are. One that we use quite a bit is called shear band. So it's a kind of a material that goes within the AFO to create a slide that is more skin protective if that's an issue. So.
Okay. Can you direct us to the great one pager that you suggested hanging up at home, the lookup? And I will.
Yeah, you guys have that, right? It's all the same stuff we worked on.
And it will be, it is available on the SBA website. It will be included in the information you receive about this presentation. And we hope that we believe it is the best document for preventing skin breakdown.
Yeah, I just love it because it is kind of consolidated into one, and it's very visual. You know, there's not too much writing on it. You just can put it up and refer to it over and over again. If you're lucky enough to have like access to a laminator, you can laminate it, or put it in a little sleeve so it doesn't get all, you know, in the bathroom. It can get kind of wet if that's where you're hanging it. But are we able to get back to our slides, or are we not in that situation?
Oh, I'm sorry. Do you not see them? Are they not visible?
I see the question.
Okay, so tell me, I apologize. I don't know where you
No,
were.
it's
So
okay.
tell me where you were.
That's okay. I think we're kind of in the middle, right after, I think we're right after checking your skin. I think we might be on, just keep going. I'll tell you when to stop.
I'm going backwards. Is that good?
Yep, keep going backwards. Perfect. And thank you everyone for your patience. I know the greatest things about technology, and then it all can go downhill quickly. So this presentation will not be up for an Oscar, we'll tell you that.
No, it's
All
good. If
right.
it wasn't for that, you couldn't have answered the questions. Keep going.
Yeah, keep going. We're almost there. One more. There we go. Perfect. Go ahead. Yep, keep going forward. One more. Perfect. Okay, risk factor number 3. We'll get back to some questions if we can too. Inactivity and mobility. When we talked about both of our cases, you know, for Jody and Joe, you know, 15 plus hours in a seated position, that's a long time. And so looking at inactivity and increasing mobility, it has to have some self-reflection from all of us. Like, how much time do I, or how much time do you spend in your chair, sitting in other chairs, sitting in bed, sitting in the wheelchair? You know, looking at, are you making frequent position changes, including, you know, moving your feet around, your legs, changing how you sit? Naturally, when you have sensation, your body sends you a trigger to move. When you lack sensation, often you don't get those triggers. And so you're more sedentary and in more of a seated position for longer. Or for my ambulatory folks, they might be more likely to lean against things or to sit on chairs that don't provide good pressure offloading, even though they have decreased sensations. So I found this for a few of my kind of school age to high school. You know, they'll be sitting on those hard school chairs that are like wood or plastic, and end up with a pressure injury, even though they're ambulatory. And so it's looking at what you're sitting on and how to prevent that. Some people have just a very small portable Roho cushion that they put on all surfaces that they sit on as a preventative tool. And then get active. Set a timer on your smartphone, on your watch, on your computer for pressure relief. Now, this is me being an overachiever every 15 minutes. If you did it every hour, I would be like, wow, champion. If you did every 2 hours, I'd be like, you're approaching championship levels here. We want you just to be moving as much as possible. Every time you lift up, don't lean on something, lean forward. You're letting the blood supply refill to that area where you've been sitting or leaning. And so it's really important to do that as we go. Next slide. So inadequate nutrition or poor hydration, looking at whether your weight is appropriate for your height. BMI isn't always, that's the body mass index. That doesn't work well for folks that don't have muscle tone kind of throughout their lower extremities. It gives an inaccurate picture. But we also know, without trying to shame anyone or throw any shade to anybody, that some of the individuals with spina bifida have trouble with being overweight. And this is an American problem. It's not just a spina bifida problem. So looking at weight, and whether you're eating a balanced diet. Are you drinking enough water to be hydrated? Are you getting enough servings of fruits and vegetables? Eating 3 healthy meals, kind of 2 hours or less of screen time. I mean, that is gets you more time to be out and active, and then trying to be, you know, up and moving around for an hour or more of kind of active time is important. And the older we get, the harder that gets, or the more set in our routines, the harder it gets. COVID didn't do us any favors for a lot of things, but especially being more sedentary. The other thing I find is that if you do have a wound, getting more protein to help your body heal is super important. So a lot of Americans eat a very high carbohydrate diet. So carbs are, pizza, mac and cheese, pasta. Those things are also more affordable. So then protein, fish, meat, cheese, eggs, peanut butter, nuts. But protein helps you heal wounds. So it's important to be able to get more of a balanced diet. Next slide. Risk factor number 4 is heat. So checking the bath or shower before you get in to make sure that you don't get a burn. Checking the temperature of surfaces before resting on your body. Here's a nice metal slide. These are just notorious for younger children getting burns if they can't feel. Curbs, you think of the holidays in the summer where people might be sitting on a curb. Those can be very hot. Car seats can be hot. Your wheelchair can be hot if you transfer out of it, leave it in the sun, and then transfer it back in. So looking for areas that would put you at risk, avoiding walking barefoot outside, and avoiding sitting too close to a radiator in cold water or a space heater. I've had a few patients too who, I love a good bonfire like the best of them, but my body's able to sense when I'm too close to the fire because I have sensation. I've had a few patients who sat too close to the bonfire and got burns on their shins because they couldn't feel that they were too close and maybe didn't notice that until the next morning when that blistering was found. The other thing is the hand warmers that people like to get for mittens to put inside mittens. They're made to go against your palms and in your shoes against the soles of your feet where the skin is tougher, but I've had patients put them in other areas like maybe under their thighs or on their abdomen to keep warm. And that has caused burns. Even though the little packs that you shake can cause a burn. So it's being very mindful of the areas of your body you can't feel and protecting that from heat and cold, both. Next slide. And then looking at prevention, overall physical conditions, attend to your knees, use reminders, set things. There's so many apps now that can help you with all different things, such as pressure relief and catheterization. Monitor your legs and feet for swelling. Consider elevating your feet when you're not walking or wheeling around. Remember that foot elevation means that your feet are elevated above the level of your heart. So it isn't just sitting in your chair and putting your feet up on another chair. It's actually getting out of your chair and getting your feet up above the level of your heart. Pressure stockings may be recommended if you have poor circulation or if you have recurrent swelling. But using those under the guidance of a healthcare provider is essential, and making sure that they are measured and fit to you, because they have a high risk of causing pressure injuries if pressure compression stockings are used and they're not the right size or fit. Checking surgical scars for thinning of the skin, potential skin breakdown, especially over bony prominence. And if you have a rash, any itching or open areas, you can consult your clinic team for management. Primary care is often a good place to at least start. They can help, with their more urgent visits. I know they're not going to give you a full wound care, in most situations, a full wound care plan, but they can at least look for those danger spots that might need to expedite your care. Be okay to press the help button. It's okay. We all need to work together to get through some of these health challenges. And like the best of them, we all need help at some points in our life. Next slide. So these we're going to breathe through. These will be available to you. But this team that worked on the Did You Look? Healthy Skin Starts With You broke down all of the things I'm talking about into age groups. So this is the infant and toddler one. And if we scroll through, we'll get to the school age and then adolescent and adult. And you can keep scrolling. I don't, the font is very small, but these are available to print and fold and use for skin protection, and they really are beneficial. to kind of look at what are the key things that we've talked about today. What are some good do's? Yeah, you can go to the next slide. Some good do's for skin protection. Do use a footrest. I argue with people a little bit here and there because there are some folks that just don't want to use a footrest, and I get it, but it promotes good alignment. It keeps the pressures more evenly distributed throughout the lower extremities and even in the buttocks area when you're not hanging, just free hanging. And it reduces pressure at the back of the knee that can interfere with circulation. So footrests adjusted to the proper length is super important. Use wheelchair and chair cushions to distribute weight evenly, and get them repaired and replaced. I believe in the state of Minnesota, you can get a new commercial cushion once a year. So take advantage of that, you know, try to replace them whenever they're due to be replaced, or if you see things that are torn, not inflating if it's a ROHO, or just not working, you're seeing redness occur in the buttocks area, like look at that cushion is number one. The other thing I found with cushions is make sure they're in the right direction. I put hands on every cushion. So when you come into my clinic, I got my hands on your cushion, not your butt cushion, like your buttocks. My hands will go there next if that's where your butt wound is, but on your wheelchair cushions, I'm feeling it to make sure, because some people have the cover on right, but the cushion's in backwards inside the cover because they took it off to wash and then they maybe hurried to put it back on, or they had a care partner that didn't realize there was a difference between the front and the back. So just making sure all your equipment is used properly is super important. Try to wear loose fitting clothing, especially if you are a wheelchair user, versus kind of rough, heavy jeans or corduroys or things that have like fancy bedazzling beads and stuff. If you're sitting on those, that's going to put you at risk. I know some of them are super cute and really cool, but they can be really hard on your skin. And my kind of most famous situation is I had somebody that was wearing a rhinestone thong. So for the women out there, you know, thong underwear, it's kind of like dental floss for underwear, but this was all made of rhinestones. And if you can't feel your skin, even for me who can feel my skin, that sounds painful. And so if you can't feel your skin, this put that person at really high risk for breakdown based on the bedazzling of their underwear. So just making sure that you're wearing appropriate fitting clothing that is soft on your skin. And then use a lap board when cooking. We've had burns, especially from microwave popcorn that comes out of the microwave. And that steam is still coming out and there's no protection on the lap, and we've had burns on the thighs from that. So making sure that you're protecting your skin. Next slide. Some other do's, you know, 5 to 10 wheelchair push-ups every hour. It's going to get you active. It's going to get that blood supply going back to the areas of your buttocks and thighs, where it's kind of decreased when you're sitting. Be careful during transfers. An interesting thing I learned years ago when I attending those great Spina Bifida conferences with patients and families is that, you know, a group had some kids with Spina Bifida draw self-portraits. And for those patients that couldn't feel their lower extremities, sometimes they didn't draw their lower extremities. So it's almost like they were disconnected from that. And so when they did transfer, those legs and stuff were banging on things. And I see it with some of my adults too. They're banging on the exam table, they're banging on the wheelchair, and that puts you at risk for wounds that are traumatic in type. Check temperature of car seats, not just like an infant or a toddler or a school age car seat, but like car seats in your car if you're driving or you're a passenger. Wear long pants when crawling. Try to avoid concrete, rough surfaces, hot surfaces. I have a patient from the summer who went to the water park and forgot his shoes. He's ambulatory, but decreased sensation, had an awesome time, but literally the skin on the bottom of his feet was gone. And it's taken him, now we're in November, this was June. We're 6 months into trying to heal these foot ulcers or from walking around on rough concrete. So put your feet up again, another kind of thing we've talked about. Take your shoes and socks off at your medical appointments. This just provides an opportunity for a provider to look at your feet and to identify any areas that might be troublesome. And then call your provider if you've got any injury to your feet or your legs, even if it's minor, because you know that when you have decreased sensation, you know, people can come in with fractures and they don't even know that there's a fracture because they can't feel. So next slide. Oh, I think we got to go back one. Yep. Here's some don'ts. Don't put a hot hair dryer or curling iron on your lap. And some of these come from patients I've seen, almost all of them. Don't put hot food, liquids, or plates in your lap without some kind of protection. Don't get too close to fireplaces, radiators, hot pipes, baseboards. Try not to wear elastic bands at the waist and the ankle that are too tight because I've had pressure injuries, especially at the waist in folds. And I know it can be hard to find the right kind of pants that stay up. And so then folks tend to buy them a little bit smaller so they stay in place, but they have caused some significant wounds. Try not to cross your legs for long periods of time. Try not to have bare feet on hot or cold wheelchair footrests. And then try not to be a smoker or a vapor because it really decreases your circulation and puts you at risk, not only for wounds, but for delayed wound healing. Next. Some summer tips. I wish we were in summer because 8 degrees this morning. I'm still bitter. Drink water, wear a hat, wear sunscreen, especially the tops of your feet. You know, if you are using a chair for mobility, the tops of your feet really at risk for getting burnt if you're wearing sandals. Avoiding insect bites, wearing good repellents, covering hot or rough surfaces before sitting down, wearing swim shoes at the pool and beach. That's super important. And then drying off your feet very carefully, drying in between each and all of your toes. Because if you leave moisture there, that puts you at risk for fungal infections, which puts you at risk for breakdown. Next. And then winter tips. Wear socks, waterproof boots if you're out in the snow or the rain, long underwear, mittens, hats. Remove wet clothing as soon as you come inside. If you're out in the Minnesota winter or other states where it's cold and it's you're out for a while, look for swelling, red marks, white or gray areas that can indicate frostbite. And if those are present, you need to contact your healthcare provider immediately. Don't just put them under hot water like some people do and hope for the best. It can be a serious medical concern, especially when you don't feel your feet or your lower extremities. That really puts you at risk for frostbite. Next. So prevention is possible. I firmly believe it starts with a look, and that starts with daily skin checks, looking at all areas, not just those with poor absent sensation, just looking head to toe for anything that looks out of the ordinary. And not everything is going to be a healthcare visit. Sometimes it's just careful watching with somebody that can give you guidance, like a PCA or a parent or a care partner, but just watching to see what changes and if that is troublesome. But if it's redness or breakdown that's associated with equipment, then make an appointment with that equipment provider right away to get it adjusted. That's essential because just ignoring the red spot is not going to make it go away. Remember Jody, she got some new shoes and they were so awesome and they look so great. And we all had shoes that were awesome and great, but when we put them on, they hurt our feet. When you can't feel your feet, they wound your feet. And so we really need to be careful about the footwear choices and to be checking that skin every single day. Control the moisture, avoid pressure if possible, eat right, get enough fluids, act on areas of redness or problems quickly, because that's what's essential. I know everyone doesn't have access, and our patients don't have access to same day. They usually have access within, a few days to a week. But again, if you notice it, then you can take some action at home to start to reduce the impact of the damage to the skin by taking pressure off that area. If you have to, stop wearing that piece of equipment for a few days, or spend more time out of your chair in a side lying position to try to get relief to that, which is hard. I know it's hard. It's the hardest thing I ask of patients often is to not sit if they're wheelchair users. And I understand that and I don't take it lightly. But if we don't get the pressure off and we don't work together to figure out what's causing the pressure and to remove it, I could give you $1 million dressing, $1 million surgery. It's not going to heal and it's just going to come back. So together we have to look at causes and take action. Next slide. And yay, that gets us back to our questions. I know that they're numerous. We can try to take a few more. I think we're at 7. So Judy, I'm not sure if we respond to them in some type of form that can go out or.
And we will do that. And I would like for you to respond, if you will, to one more question. Are you going to speak of a different cushion other than the Roho?
Yes, there's many cushions out there. The only reason I highlighted the Roho because it was the cause of this particular cushion, this particular wound that we saw was a failure of the Roho. I myself am not a fan of Roho. They require weekly maintenance, so they require someone to be checking it every week to make sure it's got the right level of air inflation. And I think that's a tough ask for families, for patients, for caregivers, for everybody. I am very spoiled. I have a seating professional with me in clinic every day. I'm so thankful for that, but I know everybody doesn't. I tend towards custom seating that is manufactured to the body type, shape, angles of the patients that I see. And we're fortunate to be able to do that in our clinic. But there are a lot of good things on the market, a lot of different commercial cushions that can be beneficial. Some combine air, some are foam, some are air and foam. But yeah, it's not saying one is better than another. It's what works for you, what provides stability and pressure relief. If you have a history of pressure injury, make sure you're talking with your wheelchair vendor when you go through the process to highlight that you need something other than a standard cushion. But there are many options out there.
Thank you. And thank you, Jenny, for this important information. We're going to end the session. The questions that have been answered will be in the recording. The questions that have not been answered, we will work with Jenny to get answers to them and include them in what we send out. We can do that, right, Juanita?
Yes, okay. We will prepare something so that you can see your questions answered.
Right. And this is so critical because, as Jenny said, years it can take to heal a wound. And we know of people who have months lying down to take the pressure off the wound, which is the only way to fix it. So the real issue is act quickly, to look and act quickly. So anyway, thank you to all of you for joining. Thank you, Jenny. And watch in the next few days for a recording of the presentation, the questions, and then we will work with Jenny to get answers to the other questions that can be answered. Thank you.
Thanks, everybody.
Yep, and good night.